What's the difference between a disc bulge, a disc herniation, and spinal stenosis? First, I think we need to start with spinal anatomy. So these are two vertebrae. You have the two vertebrae here, and then you have the disc in between. Right here, you can see the nerve running through, which goes to all your muscles, tendons, and ligaments. What I want to talk about here is actually the disc. There's two main parts of the disc that you have to remember. So you have the annulus fibrosus around, and then the nucleus pulposus in the middle. Kind of think of this as like a jelly donut. So the annulus fibrosus is hard, and the inside is more of a jelly-like substance. What can happen when you have a disc bulge, I like to use this model here, you can actually see how it protrudes out and puts pressure onto those nerves. That's a disc bulge. When that happens, a lot of our patients have low back pain, low back stiffness, tightness, dull achiness, or even sciatica if it's putting pressure on the right nerves. So that's a disc bulge. Now, what if we take it a step further and it goes to a disc herniation? That's actually where the annulus fibrosus ruptures and that jelly starts to come out, kind of like this. This is a lot more severe, and it also takes a lot longer for it to heal properly. We could look at 12 to 18 months for a complete recovery, sometimes longer depending upon what the patient did. So that's the difference between a disc bulge and a disc herniation. Now, what is spinal stenosis? Our patients that have spinal stenosis, it's where we get a lot of degeneration, where that disc is not nice and open like it should be anymore. Like this one right here, you can see how that disc is nice and open. Here you can see how the vertebrae are getting very close together, and that disc has pressure put on it. That's going to put more pressure back to where that nerve runs through. So that is the foramina, where that nerve comes out, that hole right there. And if it starts to put pressure there, that's also where our patients can start to experience numbness, tingling, even sciatica-like symptoms. So even if it's a disc bulge, disc herniation, or even spinal stenosis, a lot of our treatments here at STRIVE Integrative Health could be beneficial for those patients to help speed up recovery, but also have a better recovery too, where they can come out of it a lot stronger than what they went into the injury with. If you guys have any questions, go and comment below, or even reach out to us to get scheduled for an appointment. Hope that helps.